Hi, my name is Dr. Charles Lee. I'm a board-certified plastic surgeon here in San Francisco. Been in practice for over 20 years, have performed thousands of complex reconstructive surgery and cosmetic surgery procedures. I grew up in Chicago, trained at the University of Chicago, really where I learned my best surgical techniques. I'm also a clinical professor at the University of California, San Francisco, where I teach residents and also help the team perform very complex surgeries. Primary focus of my practice now is in performing facelift surgery, which I consider as a very complex operation that requires a high degree of surgical finesse and expertise. And I look at the face in many ways in performing a facelift as a reconstructive procedure. It's a three-dimensional part of our body. It's not just skin, there's fat, there's a SMAS, there's blood vessels, there's nerves. And your facial nerve is always safe with me because of my expertise in microsurgical surgery. Anytime I perform a facelift, my goal is to turn back the clock. Naturally, 10 to 15 years. I don't want you to look overdone. I think the best compliment after a facelift operation is when an old friend might see you and they say, wow, you look great. But the face is done so well, so naturally, scars so well hidden that all you have to say is, yeah. You know, I'm exercising, I'm healthier. You don't have to reveal what was done. And that's what I think is a great result, that it looks so good and it's very hard to tell what was done. At the time of the consultation, it's really a great time for you to get to know me and me to, of course, get to know you, to really listen to all the things that are important to you. I take every patient consultation as an individual, really tailored approach just for you. It's not a template, and I want to listen to the things that are of concern to you. A lot of times I have patients who come in and say, hey, Dr. Lee, you're a plastic surgeon. What should I do? I'm really more focused on what are the things that are bothering you and whether I can accomplish it and do it for you safely and with the best techniques. And I think an open-ended question sometimes is really not necessarily the best approach, but I want to be able to address the issue that is bothering you. I also take the time to show you 20 years of experience, showing you before and after photos of my patients, most of who are extremely happy, and they're happy to share these photos with my patients in confidence. I think that's very important to show you my work and that work that has happened for over the past 20 years. And this will give you a better idea of what you can expect before surgery, after surgery, and during the recovery time. I think it's very important to get to know you and to understand your expectations. And it's important to also know when to say no. Honesty is very important to me. And sometimes I'll even say that maybe it's not the right time, maybe it's just not the right situation to have a facelift or a surgical procedure. And I think that's very important. It takes a lot of judgment and experience to get to know and make that decision. I do have a private surgery center here that is actually connected to my office, and it's in the same building. It is very private, and it's really designed for your operation so that you get the full red carpet treatment. It is a place where I have my specialized equipment, experienced staff, some of who have been with me for almost 20 years. I have a board-certified anesthesiologist, and it really creates the best environment so that I can make and create the best outcome for you. The consultation really can take anywhere from 15 to 30 minutes. It's a time for me to get to know you and to really understand what your concerns are. I get to show you before and after photos, and we talk about everything in as much detail as possible. I want to make sure that during the consultation, I've answered all of your questions. I want to be able to address any concerns, fears, because surgery is a process that can be filled with anxiety. And I want to assure you that we're going to take great care of you, that safety is number one. And then, of course, having a top-notch, great result. That is my priority for you. And I want you to be able to leave here from this office having answered those questions and having any concerns addressed to your full satisfaction. I became a plastic surgeon because I love the idea of being able to help patients and being able to operate over the entire body. My first love was actually vascular surgery, and I thought it was just the coolest operation, where I learned that really blood flow and making sure that tissues all get good blood flow is so critical. And being able to then perform microsurgical vascular surgery, microvascular surgery, where I can move tissues and make sure that all those same techniques that we learn in reconstructive plastic surgery, microsurgery, are utilized in what's done in a facelift operation. A facelift is a very complex operation. It is not a simple operation. It's three-dimensional. There's skin, there's a smash, there's fat, there's blood vessels, and very importantly, there are nerves. And those nerves require a great deal of delicacy and precision to never be disturbed or injured. And I can tell you that when I perform these kinds of operations, your nerves, blood vessels, and all those tissues are handled so delicately, but then precisely, and then with enough power that it makes a difference for you.